Hello, everybody. Thank you for joining our webinar today. Firstly, just a quick apologies for anyone that tried to attend our previous normal pathology filing webinar. We had an office move and a technical glitch with Teams which prevented us from actually running it. Unfortunately, we didn't find out about the issue until we tried to start the webinar because we've been assured it would work perfectly well and it just didn't. So apologies and thank you for your patience. So for those of you that attended the previous webinar that didn't happen, hopefully you'll find this one of interest, and I hope that someone from our team contacted you just to see whether you wanted to meet separately. So right, MyBotGP. What we're going to do today is we like to keep our webinars very interactive. We like and welcome questions. The normal pathology filing platform works on a very specific logic. Obviously, it's managing pathology tests, which is extremely important. So we are very aware that the way that people understand things often is by asking questions. And so what we do with our webinars is we'll go through the presentation, some of the presentation. We will pause for questions, and then we'll go back to the presentation, and we're happy to pause again for questions, and then we can have a Q&A at the end. So John is our sales director, Sanj is our technical director. They will support me today and all of us on this webinar. What we kindly ask is, if you have questions, please feel free to put them in the chat. Someone will be watching the chat. What we will do is we will pause, we will share the questions so the group can learn from the questions and answers that are being asked, and then we'll go back to the presentation. So please feel free to pop anything you like into the chat, and then we'll answer those when we have our breaks. And then at the end, if we have time, we'll have a specific Q&A. So without further ado, MyBotGP range, this presentation is for our normal pathology management platform. This platform is available and working in hundreds of practices across the UK for both EMIS and SystmOne. So this platform works in EMIS and SystmOne. In addition to this, for EMIS, we have a document management automation, and we have a repeat prescription management automation. And we hope to be launching in the next 3 to 4 months, I would have thought, an equivalent letter management platform for SystmOne as well. So watch this space, and we'll add you to our newsletter. So as soon as that's live, you can have a look at it and see what you think. So this platform, normal pathology management for EMIS and SystmOne. We like to use the line here, not all normal results are normal for the patient. So what this tool isn't is something that's just going to read all the normal path tests and file them for you. Obviously, that would be ridiculous because pathology tests are there just to check the pathology test. They're not looking at patient history, medication, health conditions, and percentage increases and decreases. So what our tool does is it manages all of your pathology tests, and it can vet them based on your rules to define whether the patient needs further investigation. And we'll go into in a few moments exactly what that means. So just a very short piece on who we are. We're an NHS ICT partner, quite unusual for a private company to be an NHS ICT partner. That doesn't mean we're an NHS organisation. What it means is we're a private organisation that has been deemed suitable to become an NHS ICT partner. And what that means for you is that if you buy MyBotGP, it resides in NHS Cloud. So it's massively important. All of our range of products lives in NHS Cloud. So that means things like DTACs, DPIAs, data sharing agreements, all of that type of stuff is very clean and without an issue. So in principle, if you joined us, we could plug you in and you could be working the next day. So we also won a place on Health Innovation Launchpad program several years ago, and we're supporting hundreds of practices now, PCNs, federations, and ICBs nationally. So our pathology management platform is a medical device, which is super important, and it also has DCB 0129 certification. DCB 0129 certification, for those of you that aren't aware, is the NHS required certification in terms of safety. For our clients that take our product, we've also taken the time to build a DCBO 160 for you, which is quite a comprehensive document, and it will save you a lot of time. We share a template, and practices can tweak that template, or PCNs can tweak that template. We have different pricing depending on who's taking our tooling. What we've seen in the last couple of years is lots more PCNs making acquisitions. So we took the time to build out PCN packages. So we have practice packages and practice pricing and PCN pricing packages. We can cover off what those are at a later date. But needless to say, centralized paperwork, documentation, and a different pricing model. Our mission is to reduce practice costs, help you to do more with less by leveraging automation tools. And what's super important for us and all of our MyBotGP range is we want to help you to be able to use your own practice rules, so your rules, your way. All of our kit can be bespoke to the practice level. Why that's important is you all like doing the same thing in a slightly different way. So if MyBotGP is acquired by a PCN, there could be 5 practices, 7 practices, 2 practices, whatever the number. You each get your own copy and you can do with it as you wish. And that becomes really important, especially for pathology management, because different clinicians will have different opinions on how to validate pathology tests. So we don't hold you back. They can express themselves as they wish. This is just a quick slide. It's around perceptions of time. So we're building automation products for primary care. So our brains are all around where can we save time. And one of the things that people don't think about, and humans generally aren't good at recognizing how long things take. So, and the analogy we like to give is 15 minutes a day is not a small amount of time. It might feel like a small amount of time, but it's not a small amount of time. So when you take into consideration an average working week is 40 hours. Then you can take off lunches for those of you that are able to take lunches, breaks, so on and so forth. It's considerably less. But 15 minutes a day equates to 91.25 hours a year. That's over 2 weeks based on 40 hours. 30 minutes a day is 182.5 hours a year, 4.5 weeks. And 60 minutes a day obviously is 365 hours a year, 9 weeks. So when someone says to you, or when you're doing something and you think, oh, it just takes 15 minutes, it will be fine, you can get that time back. And actually, that's quite a considerable amount of time. Now, if you look at something like pathology management at a practice, pathology management is managed by multiple clinicians because those numbers are just based on one person. So you could have 4, 5, 6, 7, 8 clinicians at one practice doing something for 15 minutes or 30 minutes every day that they could get support and not have to do anymore. And the current calculation for MyBotGP for our pathology management platform is it could potentially save every clinician at your practice up to 30 minutes a day. So this is the business case. So obviously we've had to pick a sample size, and we'll get to the logic of the platform and the rules in a moment. But just to set this up, so you can see where the logic of why this tool is so popular. So on average, a practice with 8,500 patients and 5 partners will receive approximately 200 pathology tests every single day. That unbelievably equates to a staggering 62,400 pathology tests to review and file every year. And that's at a list of 8,500 patients. And obviously on this call, there'll be smaller practices, bigger practices, and PCNs, but each one will have an equivalent amount of partners that have to do the equivalent amount of work. And current NHS calculations, when you take into consideration that our tooling can do additional checks, every clinician spends up to 30 minutes a day, every day on this task. So if you have 5 clinicians, it's 5 times 30. And we'll come back to that in a minute. Now, all pathology tests must be manually reviewed and filed and sit in 3 buckets. Normal, no action. Normal, but might need action, i.e. check the patient history or the pathology report for medication or health conditions, and we'll come back to that in a moment, or abnormal. So if you just think about that for a second, 62,500, just under 62,500 pathology tests a year sit in 3 buckets: normal, no action, normal, might need action, because obviously the lab is only looking at the path report. They're not looking at the patient. They're just looking at a range or a keyword. So normal, no action, normal but might need action, or abnormal. Current stats, we used to have this at 70%, and that's now been updated. But the current stats is up to 80% now of those tests. So in the scenario of an 8,500 list, that's just under 50,000 pathology tests a year could be managed by MyBotGP, and you will no longer need to do this manually. Now, the ones that MyBotGP will look after for you are normal, no action, and normal, but might need action. And we'll explore in a moment what might need action means. So 80% could be looked after by MyBotGP, normal no action, normal might need action, i.e. checking against the patient to see whether that path test isn't the final check you need to do on a patient. In addition to that, what we're seeing a lot of now is that lots of our clients take great pleasure in being able to ensure that additional checks are carried out where required on all pathology tests. So you can set MyBotGP to do additional checks on every pathology test. So you've got increased checking. It can provide standardization for a practice and cover for holidays. We've got lots of clients that want particular path tests managed in a specific way. They can now enforce that at practice level, whether they're there or not there. And obviously, help support reducing clinical fatigue. So it's there to drive down cost, add additional checks and support clinicians. So your potential cost and time saving from MyBotGP based on 5 partners. Each partner spends 30 minutes a day. For a practice, that's almost 12 hours a week, which is 1.5 days a week of clinical time. Each partner would spend 19 days a year, and for this scenario practice, that's actually 16 weeks of clinical time at an approximate cost of about £45,500 of clinical salary. That's the business case. So now we'll get to the interesting part. What does MyBotGP actually do? How does it do these additional checks? And again, we'll stop for questions in a couple of minutes, and then we can go back to continue. So MyBotGP works 365 days a year. It's used by practices across the UK to manage up to 200 different pathology tests. Now, you can combine any of these rules to validate pathology test results, and what they mean for patients then file or flag. And what does that mean? So what it means is that you can add 1, 2, 3, or all 5 of these rules on each pathology test to make a decision as to whether that is normal and doesn't need to be looked at, or whether it's normal but you still need to look at the patient. So the rules run in this order. And again, you can combine these rules, and hopefully Deandra will have shared with you a spreadsheet, if we're going to pull this up on the screen anyway, which can show you what your colleagues, what path tests and rules your colleagues are using MyBotGP to look after for them across the country. So the first rule is, do you agree with the lab? So the lab is going to send you a path test with minimum and maximum ranges. So if you agree with the lab, yeah, okay. Second rule is, do you want to supersede the lab? So some of our clients like to supersede some of the lab ranges because they believe that they're not 100% correct and they want to set their own ranges. We see that some of our clients doing that with full blood count. They set slightly higher tolerances on some of the path tests if the other path tests are coming through as normal. Again, not all clients do that, some do, but it's up to you. So it will prevent some coming through as abnormals when in fact you believe they are normals. MyBotGP can compare tests. So what does that mean? It can check. What it means is it can read a path test. It can then go back into the patient record, look at a previous path test, and measure a percentage increase or decrease. So you can set tolerances in there where you could say you're happy with that path test, even though it's normal, unless it's gone up by a certain percentage since the last test, and then you want that failed. And I'll give you an example in a moment of some of those tests that clients are using that rule for. MyBotGP can also read, this is super important, it can read the patient history and the pathology report. So it can go into the patient history, read the problem pages, and it can read the path report. Why does it do that? Well, it can do that so you can check to see whether a patient is on a specific medication, or as a health condition. So you could say stuff like, I'm happy to pass this test unless this patient is on this medication, then I want it failed, because a normal might come through as normal, but they might be on a medication that means you still want to look at that patient. So there's an additional safety in there. It can also read the pathology test reports, and it can look for warning messages. You know, HbA1c, does it say diabetes or pre-diabetes? It can also read path tests that don't have ranges. So it can look for stuff like positive, negative, detected, not detected. So you can include a whole raft of tests that use that logic. Hence why we've got 200 different path tests being used. You can separate off, obviously, in terms of age and gender. You can omit patients. Some patients you might not want the tool looking at. You can just pop in their details and it won't. And just so you rest assured, nothing is removed from your system. You still have full visibility of all the tests in EMIS and SystmOne. And then obviously it goes without saying, it will file for you if you want it to file. So that task is removed. And if you want, it can send a text message. So if you're linked to Accurix, it will just plug into Accurix and send whatever message you want sent. And then for our SystmOne clients, it can send messages through SystmOne. So if you just run over that super quickly, you can combine any combination of these rules. So an example is, well, agree with the lab, supersede the lab, compare tests against a previous test, check the patient history for medication or health conditions, age, gender, warnings on the path report, omit patients. So an example that we like to use is prostate. So prostate actually combines, we've seen our clients use prostate to combine all of these rules just in one path test. So some of our clients have MyBotGP set up. What they do is they set it up to have 5 different ages and 5 different ranges. So MyBotGP will pick the path test up and work on those. Other clients use a different logic. And again, it's up to you what logic you use. What they do is they say, no, we want to agree with the lab. However, if the patient is coming through as normal, we still want it to check against a previous test result. And if that test result has gone up by more than 10%, we want that failed. So just with prostate, you can see we have a collection of practices that have 5 ages, 5 ranges. Another group of practices that say, no, we want to just check for quick increases, as that's how we want to use the tool. And in addition to that, you can tell MyBotGP to look in the patient record, and if it sees cancer or prostate cancer or metastatic cancer, just skip it anyway because the doctor wants to look at it. So if you start thinking about stuff like renal, kidneys, iron tests, and I'll show you a list in a moment of the different path tests, but you can combine all of the tests, all of the logic, or use individual pieces of logic. It's actually, this is the configuration panel. It's super easy to set your pathology test rules. Doesn't take long at all. The bit that you need to think about, obviously, is what rules you want to add. But we can share examples of multiple practices, the rules that they've added. What our clients generally do is cast their eye over those, pick the most, 10, 20, 30 most straightforward, add them to begin with, and then continue to add path tests. But actually, the configuration of the panel doesn't take long at all. It takes about 3.5 hours in total. And generally speaking, clients add 20 or 30 a week, 40 a week. So it's about over that 3.5 hours is over 3 to 4 weeks. So what you're looking at here, let's say, for example, this is a liver function test. Just for this example, these are the ranges that the labs has provided. We get all of the ranges for MyBotGP directly from your lab. It will suck them up, so you don't have to worry about putting the ranges in yourself. The default is correct. MyBotGP will also send you a notification if a lab changes the range. So you've got a safety there, a different conversation. And then you're looking at the logic here. So we're at number 2, where it says file for normal report. So if you looked at this test and you decided that you were very happy to file this path test, doesn't need any additional checks, as long as the patient sat within all of these ranges, then you would tick that box. And from that point onwards, every time MyBotGP sees that, it will file it for you in the patient record. If any one of these is a fail, it will fail it. Now, let's say you're not happy with that, or you are happy with the ranges, but you want to add additional checks. So it's quite simple to do. All you would do here is, you can see where it says keywords, no keyword check, keyword is present, keyword is absent, keyword in the problem page. This is where you would click on the appropriate box and say, look for a particular medication or health condition or warning on the path report. So you could say, I'm happy for you to file based on these, as long as you don't see a particular medication. Or you could say, I'm happy with these ranges. Apart from this one, I want you to check against the previous test result where you're looking at number 6 here. You just click yes, and you'd put the percentage increase or decrease that's acceptable before it's a fail and you want to look at it. Obviously, you've got your filing strings where you can comment, and you can bespoke. You can bespoke as much as you want. And if you want to send a text message, you can just click this box and it will send a text message. So what we see with our clients more recently is they're quite picky about the path test that they send text messages for. So you just tick the appropriate one. So if you think about the rules again, and then I'll show you the spreadsheet example, and then I think we should stop for questions. I can see John typing away, so I'm assuming stuff is coming into the chat. So filtering rules are as follows. MyBotGP will work 365 days a year, looking after up to 200 different pathology tests. You can combine any of these rules to validate a pathology test result and what they mean for the patient, then either file it or leave it, flag it. So when you're setting it up, do you agree with the lab? Do you disagree with the lab and want to set some of your own ranges? Do you want to compare tests against previous test results? MyBotGP can read the patient history in a pathology test report to look for medications or health conditions in the patient record that might mean you need to see that patient even though their path test has come up as normal. So they're not missed, and you can set those as default. So you've got additional checks. Check for warning messages on the path report itself. HbA1c, does it say diabetes or pre-diabetes? Positive, negative, detected, not detected. Age, gender. Nothing's removed from your system, so you don't have to worry about stuff disappearing. Everything is still in your system, and it's all hosted from the cloud. All you do is from your computer, you'd log into MyBotGP and you'd add your own rules. So what I'm going to do now, before we stop for questions, is show you a quick snapshot of pathology tests here. So what this is, we've compiled this. This is just an indicative snapshot. We're not telling you these are the rules that you should add. This is an indicative snapshot of 181 different pathology tests that our clients across the country are using MyBotGP to manage for them. And I'll explain to you here, and we can show some examples, and then we'll stop for questions. So what you're looking at here, if you look at the top, and we've got lots of these sheets that we'll share with you, obviously, if you take the product, so you can get it configured super quick. Here you've got enabled means they've given it permission to look after for them. Here's a path test name, sub-test name, gender, age, check for normals, ranges, check against the previous test result, check for keywords, filing stream, comments and filing streams, you can see here. So that's those rules that we just looked at. I can pull up this test here. That's these rules on the spreadsheet in reality for you. So if we take the prostate example, just because I mentioned it before, it's quite an interesting one. What you can see here from 116 to 117 is how some of our clients set the tool up. I think this is actually the new prerequisite from the NHS. Again, different conversation. Here you have 5 ages. You can see the 5 age ranges. So they've broken the test up into 5 age ranges and the 5 ranges. So they're superseding the lab with age and range. In addition to that, you can see here, and in the top left-hand corner, keyword absent from the problem page. They've leveraged the keyword safety. And you can see here they've put in the words prostate cancer, metastatic prostate cancer. The test below it, you can see here, just because it shows here, SE thyroid, peroxidase, that's pronounced correctly. Here, maximum value, 5.5. However, they've asked MyBotGP to check patient history and or path report for those keywords. Excuse me. Show you HbA1c. We also see a lot of differences with renal. Some start at 60, some start at 90. Some want to check against the previous test result and start at 60, others don't. I guess what I'm saying is you can configure this how you want. It's your tool to configure as you want, as you believe is correct. And once you set these tests up, it's gonna sit at the front of EMIS or SystmOne. Everything's gonna push through it, and it's just gonna, because it's an automated machine, it's gonna just run those checks on everything 7 days a week. So HbA1c, what they've done, a selection of clients have used 20 to 41, not interested in checking against the previous test result. However, look for the words diabetes or pre-diabetes and then skip it. You can see here the negative, not detected, medication. The keywords are leveraged a lot. AKD, CKD. And we do see a selection of clients, adjusting the ranges. So we can see what logic you set up, and we can see volumes. But just to make it clear, we cannot see any patient data, so we don't see any more than that. We just know when the tool runs, how long it runs for. Okay, so it feels like a good place to stop for a moment for questions. I'm also going to cough, so apologies.
No problem, James.
Okay.
We had a couple of comments, and I responded to that initially. And then we had a comment or a question from Richard. Richard is saying, so you can check for a code in the notes, and if they then apply a different rule?
Okay, so let me just look at that. So can you check for a code in the notes and then apply a different rule? Well, you can check for the code and apply a rule based on that code. Sanj, that's correct, no?
Yeah, I mean, if you're saying about notes, is that the lab notes or is that the patient history? So you can apply one rule as opposed to a different rule. So the rule would be, are you in range? And also look for it in absence of this particular condition within the problem page. So you can do that. If you're looking to do sort of multi-ranges, that's not possible, but you can do a rule, and that rule encompass a range and look for in either a keyword being present or absent, and then it will file based on that one rule that you've applied.
Thank you, Sanj. Hopefully that answers your question. If it doesn't, please add in. Please come back. So next question, once enabled, it starts filing results. Is this correct? Yes, that's correct. As you enable, what will happen is we'll plug it in. It's going to read all of your pathology tests and it's going to save them in the memory. Okay, because what it's doing is it's grabbing your ranges from your lab, because obviously we, across the country, different labs use different ranges, so on. And we've even got some clients who've got 2 labs. And then everything will be in purple, and then you'll log into MyBotGP. You'll double click on. Let me just share my screen again very quickly. We can show you something else. You'll double click on. Hang on a sec. Is it sharing yet?
Yes.
Yeah. Okay. You'll double click on the specific path test, and it will look something like that. You'll add your whatever you want to add. You'll either say, "Oh, I'm happy with the lab. Agree with the lab. Tick that one, file for normal report," or you'll say, "No, I want to send a text, change a range, previous test, or look for a keyword." You'll press save, and then it will go enabled, and it will start filing that path test. So when you first turn it on, there'll obviously be hundreds of path tests. They'll probably, well, we see, depending on the size of the practice and how many labs, some have got up to about 220, 230 different path tests. Some of our clients have got about 100, 110 different path tests that they get from the lab. And you'll go through the list and you'll add them, and you'll press save and it'll go enabled, and then it will start working. And it's about 3.5 hours work is what we've seen over a 3 to 4 week period from our clients, because we'll share the spreadsheets with you first. And then I don't know if I mentioned this earlier, but generally speaking, we haven't had a practice yet turn this on, add 120 path tests straight off the bat. That never happens. So what you'll do is you'll turn it on. It will save them in the memory. You'll go through the spreadsheet. You'll pick out 20 or 30 pathology tests that you feel quite comfortable starting with. You will enable them to answer your question. It will start managing them. You'll start to get used to have this new piece of software working at the practice. Double check the audits and make sure that you can go to bed at night knowing that it's working as it should in the background. About a week later, what we've seen is they generally log back in again. You'll add another 20, 30 path tests. And then by about week 3, week 4, we just see the numbers go all the way up. We also, I should add, run weekly client training webinars for all of our products. So we have one for Document, we have one for pathology management, we have one for repeats. And what they are invite-only client drop-in training webinars. We will run them if we have one client, and we run them if we have 50 clients. And what we see, especially for this tool, you drop into 1 or 2 of those sessions as well if you've got any specific questions. And then but there's a running open invite. So once enabled, it starts filing from EMIS. Yes. The question says, sorry, Sanj.
Shall I pick this one up? I think there's just a bit more information.
Read the question out first.
Yeah, certainly. So thank you, Richard. So the question, I suppose, is to have one set of rules for prostate, but then to take down a separate set of logic if prostate cancer is coded, and again, separate set of rules if prostatectomy is coded. So 100%. So the way we would typically handle something like this in the platform would be you'd put in your prostate ranges by age, the separate ranges. And then within the keyword section, you've got is keyword absence from problem page. So you typically put in a keyword like cancer. So what you're saying there in that basis is there's 2 rules. And as long as those 2 rules are satisfied, MyBotGP will file. So those 2 rules would be, is the patient in range based on the age, and in absence of the condition of cancer, i.e. found within the problem page, would MyBotGP file? So and that's the typical way one would handle that type of condition.
Thank you, Sanj. Any other questions? I can share the spreadsheet again, and we'll share the spreadsheets afterwards.
Yeah, I think it's actually on there. I think in absence of cancer and range, so that would then, I think it's there.
Just share my screen again. Okay, is that coming through?
Yes.
Yeah. Okay. Yeah. So if we go back to prostate, goes there. So here we have the prostate example. Some of our clients use ages, as we were saying, ranges are here. Obviously, these are the ranges, age ranges rather. And then if you look in the top left-hand corner over here, which is where you can see the keywords and the leveraging. So keyword absent in the problem page, and here
that's correct.
Yeah, the keywords that site has used.
So that's just to reiterate, that's 2 rules you're setting for MyBotGP. Is the patient in range? Rule number 1. And does that patient have in absence of that particular condition within the problem page? If it's absent and it's in range, MyBotGP will file.
Okay, you can see the keywords here are super. They're battered everywhere. So if we go back to the purpose of this tool, it's sort of over the last couple of years, it's almost taken on a life of its own, where it started off as an automation that would help you, file normal pathology test results, and it's grown into a tool where you can enforce additional checks to validate if normals are normal and decide whether you want to file or not, or whether you want to have a look at them. I'm going to cough again, apologies. Every single time we do a webinar, I cough. And again, these are the rules that you can use. So, try and get that out of the way. John, do you want to run over the audit look?
Yeah, for sure. So as James mentioned earlier, nothing is removed. You always have the ability to go back and cast your eye over it. In terms of the audit log, there are 2 ways in which you are able to get the information back. You have the audit log that's based on the application, where you can log in on a daily basis. And essentially what would happen is you have the ability to look at the number of filings that happen over that day. You could look at the number of filings by the category, and then you have a granular view to have a look at any path tests that may or may not have been filed and what the reasons those are, i.e. you have not given it permission to be automated by the bot, and then you simply click on that, and as James said, it's in purple. Apply your rules, enable, and the next time that will not be there, and the bot will automate that piece completely.
Thank you. I think my coughs save up for the webinars. Right, we'll run over costs quickly, and then we can stop for questions again. You can see it. We can show you a quick demo where you can see MyBotGP in action. So the way that we work is quite straightforward with our pricing. All of our products are priced in the same way. There is a slightly different pricing mechanism for PCNs, which we can cover over if there are PCNs on here or separately after the call. Works out about 10% reduction, which depending on the size of the PCN can be quite significant. So it's an annual subscription, one practice and one product, 749, and then list times 30p. So if we go back to this 8,500 list scenario that we've been talking about from the beginning, this one up here. Just under 62,500 path tests, approximately 5 partners, 200 a day, 50,000, just under 50,000 managed, and the clinical cost and time potential save in having that looked after by an automated platform. We price this way because we believe it's fair. We're very passionate about what we're doing. We're hoping that people will take our products, keep it for many, many years, and then take additional products. We also want to make it within reach of small, medium, and large practices. So 749 list times 30p, annual subscription. And in addition to that, there's an NHS cloud cost, which depends on your list size. And invariably, if you have less than 10,000 patients, it's 7p a patient. 10 to 15,000 pence is charged at 6p. 15,500 is charged at 5p. But to keep things simple, an example calculation based on a list of 8,500 practice works out 3,887 per year for unlimited pathology tests and volumes. If you take a second product with us, there's a reduction in cost. All hosting is charged at 5p, and that's reduced from 749 to 499. So for EMIS practices may want to take document or repeat prescriptions, and for SystmOne clients, hopefully when our attaching docs letter management platform is launched, you can have a look at that and see whether that's of interest to you. So any questions on pricing? John, anything going on in there?
Nothing as yet.
Okay, good stuff. Thank you. So, do we have any other questions before we move on?
There's just a question. Rich is asking, is there a trial period? Sure. So in terms of a trial period, we have a minimum 12-month trial period. Typically, what we see is our customers take a 2-year contract. In year 2, there's a price freeze. And typically that's what we get in terms of the normal. This is a mature product. It works, and as such, the minimum trial period is 12 months. There is some upfront cost in terms of the hosting, so that's also something to keep in mind as well. Sure. So my understanding is we're going to show a quick video of it in action. Let me quickly see if I can share. Forgive me while I go put it up. James, in fact, is it something that you can put up and share? And then Sanj can just talk through that.
Shall I pick it up from here?
Yes, please.
Yeah. Okay, so if we just move this, so this is basically the overview screen. So as James mentioned, when MyBotGP runs, it extracts every single pathology category it sees within your EMIS and SystmOne. And by doing so, it grabs the lab ranges which have been stated and that come through into your clinical system, and it presents them within the platform in this screen here. So as you can see from left to right, we've got all of the path tests, all of the subtest values, all the subtests, and then the values to the right of that. And then obviously, based on the logic and the rules that one has set, you can sort of see within the platform, how you've set the rules to file. Now, if we just scroll it on a little bit, I just want to take you through to the details screen, where one can actually set up the rules. There we go. That'd be perfect. Yeah, so I can sort of run through. So as I say, anywhere where you drill down onto one of those path tests, it takes you into this detail screen. Here we go. If we just pause it here, James, that'd be perfect. I can just run through it here. Now, as we can see here from left to right, you've got the pathology category at the top. So we can see it says full blood count on the top left-hand corner. Now, to the right of that, you've got all of the subtest values that the lab has sent through, and also the lab ranges that have been sent through. And you can see, as you can see, bacillus count, etc., etc. Now, to the right of that screen, you're able to then state whether you want to do a previous test result check. And then state, for example, the percentage above and below. So essentially what you're doing there is you're asking MyBotGP to take the current test result, compare it against the previous test result, and check for a percentage above or below, as stated in that numerical value that you pop into that white box. Okay. You're also able to, as you can see, you've got the min-max ranges. For example, basophil count is 0 to 0.1. One can override those ranges as well. So if you said, okay, I want to make that 0.8 or 1.2, etc., you simply overwrite that. And following on from that theme, you can also then split ranges by age and gender within the platform. And then again, that's just marked with an M or an F or the age range next to the actual subtest value. So again, just giving you context as to what you can do in the platform here. And then, as I say, if we just play this on for hemoglobin estimation, I think this has been split out. There you go. So as you can see, that as a test is running, you can see it's been split out male and female, allowing you to put individual ranges by gender. And also in this particular example, there's been a 10% above and below percentage previous test result check as well being placed. Quite typically we see that against hemoglobin, hematocrit as well as a popular one that's split out by age, by gender as well. So if we just follow that on, and then, yeah, good stuff. I think we'll go to another one. So as you can see, I think we're going to go to HbA1c. So if we just pause that there. So again, as James mentioned, it's your rules, your way. You're not going to use every single rule for every single path test. You're going to use a variety of rules. So for what do I mean by that? For certain path tests, you will be happy with, is the patient in range. For certain other tests, you'll want to do a range and a keyword check. And for others, which are textual in nature, like, I don't know, FOBT normal, you may just want to file based on a keyword. So for example, this is a very popular one where we can see the HbA1c range is applied, and also in absence of the word diabetes within the problem page. So if we just play that on, James.
Can you hear me yet?
Yes, you're back.
There
you go.
Oh, that was
so should I just finish?
Yeah, please.
Finish off
yeah.
Cool. So again, just to reiterate, and I think it's really important to note, and why and how one can sort of stretch to the 180, 200 path tests within the platform. It's because you've got different rules to apply. And what do I mean by that? So you can have by range, but you can split your ranges by age, by gender, do previous test results. You can also, as I say, on top of that range, I think as Richard mentioned earlier, you may want to do a keyword check. So you can ask for MyBotGP to look at the actual path test and look for specific words. So as you can see on the left hand side, you've got keyword is present and absent. So for example, you could look for, in absence of the acronyms AKI and CKD for LFTs, you could look for, specific words like FOBT normal, etc., etc. So what I'm trying to do is provide sort of tangible examples where you can apply a range. You can apply a range and a keyword, or a keyword is absent and a range. Or again, for textual path test, i.e. where there are no numerical values provided by the lab, you simply may want to just file based on a collection of keywords, i.e. negative, not detected, etc., etc. And that's where that spreadsheet comes to life, giving you examples of differing words that are used to file, because all labs use differing words, and you may want to just file on that basis.
Thank you, Sanj. Thank you.
Pleasure. Pleasure.
Thanks. Any other questions before we move on? I think we've got about 10 minutes left. Is there anything? Well, firstly, can you hear me? Oh, he said thank you,
Yes,
so you
we
must
can
have
hear
heard that. Yeah.
Yeah.
John, any other questions?
One question. So what about results that are on Portal Cerner or Center, or is it strictly from the pathology lab only?
Sanj,
Yeah.
I'll let you answer that.
So the way the tooling works is, and it works the same for EMIS and SystmOne, is it will log into the pathology inbox. And again, you will provide access where it can see all path tests for all clinicians, and then it gets to work based on your standardized rules. Hopefully that answers it. Only going to log into pathology inbox for both EMIS and SystmOne. That's where it grabs the path tests and applies all these rules and files accordingly, and then again archives them as well for you, which is really important. Thank you.
Thanks. Please keep putting the questions in while I'll just run another video, and then we'll do a quick summary and wrap up. We've got about 10 minutes left, so please pop any more questions in. So this is what you're seeing here is like for us, obviously we see this every day. It's almost, this is the bot running in the background. So MyBotGP lives in NHS Cloud, so it's just going to log in remotely. You won't see it. There's no computer needed at the practice. There's nothing like that. Think of it as a remote worker at home somewhere. That you've said, right, you're allowed to do an initial sweep of all my path tests, but I want you to apply all these different rules on each individual one. And that person doesn't get bored, does it day and night, weekends, holidays, and doesn't make mistakes because it's a machine. So it's just going to log in with its own username and password for EMIS or SystmOne, exactly the same way a person would. The login details will be locked down, so the bot can only access the path test reports. It can't deviate, can't change. It will have its own name, so you've got an audit log of whatever it's touched. And then if you were to open up a screen and watch what it's doing in the background, and this has been redacted because one of our clients let us film it just for demo purposes. We wanted to show you a live environment. Is like a ghost working in the background. It's just, actually I can show you the initial login page, but you can see and you can ignore this bit over here. This is just for demo purposes. You wouldn't have that. It's logged in with its own username and password, which is unique to the bot. And then it's going to say, right, okay, what do I do? Right, well, this is EMIS, obviously, the same principle in SystmOne. It's going to navigate to the inbox, as Sandra was saying before. It's going to grab all the path tests, and it's going to, am I allowed to touch this one? Yes, I am. What rules do I apply? Pass, fail. Next. Am I allowed to touch this one? No. Okay, skip it. Next one. Am I allowed to touch it? Yes. Okay, what rules do I apply? And it's just a machine, and it will run 7 days a week, 365 days a year. So, and you can just see it running in the background now. And then obviously, as John covered off on the report, you'll get a full audit log. You still have the full audit log within EMIS and within SystmOne. In addition to that, you have an audit log from us as well. So you've got two to compare. Full access to it. It's locked down. Obviously, only certain people at the practice can log into it. However, we do have an email distribution list where if you wanted someone else to run validations and reconciliations and stuff, you can have an email sent with a spreadsheet to the appropriate person at the practice. It's an extremely robust tool. This is running thousands and that is processing thousands and thousands of pathology tests a day across the country. Yeah, it just runs. Especially as it runs from NHS Cloud. So, it just runs. You can see here it's going through. I just forward this on a little bit so we can get to questions. You can see the manual keystrokes. It's doing exactly the same thing that a person does. So think of it as, just as I was saying before, you've given someone permission to take over and a portion of this task for you. You've told them what they're allowed to touch, what they're not allowed to touch, rules to apply. and they're following your manual in the background. Now, one of the big USPs with this tool as well, and let me just pause this and I'll get back to the brochure. Because it's self-configurable, it means that you can, if you are sitting down having a coffee and you suddenly think, oh, do you know what, I can actually add another path test, or I want to make something a bit tighter or a bit looser, you can log in with a username and password and you can make the change and press save in a couple of seconds. You don't have to come back to us. That's really important. This is your tool. You're in full control of it. The other thing that we've done, we recently patched this tool. What that means is, like a mobile phone, where you get a red thing and it says turn it off and on, and you get more functionality. We patch our tooling, as you would expect. It's now able to pick up if a lab has changed a range. So sometimes labs change ranges. They're supposed to tell you. Maybe they have, maybe they haven't, maybe it was missed, maybe they missed it, but for whatever reason, there's an additional safety that pops up and says, hey, this range has changed, so that you can then go back in, open it up, and then adjust your filtering rules against the appropriate range. And there's literally, as you saw in the other demo, you open it up and change that to 31, press save. If we scroll this back to the beginning of why you're on this call, really quickly we'll run over the rules. Unless there's any, just give me a shout, John, please, if there's any questions that pop in. But we're not good at reconciling how long things take. Pathology management takes longer than 15 minutes a day. This scenario, 15 minutes a day isn't much time. It's 2 weeks a year. Pathology management's done by your most, highly precious staff. You've got other stuff to do. Every GP of the practice is doing this task. About 80% of your path tests can run through this platform and do the initial sweep. So based on an 8,500 list, 5 partners, just 62,400 path tests, you can have 50,000 path tests having MyBotGP do an initial sweep to, because otherwise you're manually doing it yourself. So you won't have to manually do it anymore. And they sit in the buckets: normal, no action, normal, might need action, but you need to check the patient history or path report, or abnormal. And the time saving is astronomical when you really think about it. Just based on an 8,500 list with 5 patients, that's 16 weeks of clinical time over a year. Each partner gets 19 days back. And the rules are really solid and straightforward. Agree with the lab, supersede the lab, compare tests against previous test result, read the patient history and pathology test report, check for medications, check for health conditions, check for warnings on the path report, age, gender, and obviously there's a full audit log. And we have weekly client training webinars. This tool, this is the bit that obviously requires the most thought. What rules you're going to add. We'll share several spreadsheets with you, so you can see how your colleagues are approaching different path tests and make your own decisions. About 3.5 hours of clinical work, and we rarely have people attend more than 1 or 2 training webinars per path, because it is literally drop-down menus. This is the bit to have a think about. But we give you a massive heads up because we've got these templates that we can share now. And what we would ask is, when you join us, that 6 months in, if you don't mind sending us your rules, so we can put them in our database, and then as more people join, we can share more and more and more. So before we wrap up, just wanted to see if there are any more questions before we wrap up. So I'll just give it a moment.
Nothing further yet, James, but let's just give it a moment, as you mentioned.
Okay, it looks like we don't have any more questions. So I guess what we'll say is thank you for joining us today. For those of you that tried to attend the previous webinar, apologies again. It was as painful for us as it was for you. We were all ready and prepared for that. It's only ever happened once, and we run these webinars 3 to 4 times a month. I'm pleased that we got this one through, even with my cough. Thank you to John. Thank you to Sanjeev. What we're going to do is we'll save this. It will go on our website. All of our webinars are on our website. within a couple of days, and then we'll email you a copy, and John and his colleagues, Farrell, Albert, will reach out. And if you've got any questions, or please get back to them. If you want to proceed, let us know. We just have someone typing something here before we finish up. Just give us a moment and see what is being said. See people dropping. Okay, no, thank you. Okay, good stuff. Thank you very much. And we look forward to seeing you.